Okay, last video for the skeletal system. We're going to zoom in down here towards the feet, and we're going to talk about the bones, the ankle bones, and then also the bones of the feet. And they're not too hard. Let's take a look over here at the left foot and the left ankle. And you got lots of ligaments down here. I'm going to hide those so we can see the bones a little bit better. There you go. And if you've ever sprained your ankle, you may very well have torn one of those ligaments. Ligaments, dense connective tissue, if you guys remember, dense connective tissue does not heal very easily because it does not have a good blood supply because of all of those protein fibers that are packed in there. So a lot of times, if you've ever sprained your ankle before, I have, it takes a long time for it to heal. Okay, so the ankle bones, you have 7 tarsals or ankle bones on each side. So let's click on all those. All right, now that big one right there, the heel bone, is called the calcaneus. That one you do need to know the name of. And then the one superior to it that articulates with the tibia and the fibula, that one is called the talus. So those two you actually do need to know the names of, the two biggies. Calcaneus is the heel, the talus is the one on which the tibia and the fibula are articulating, forming a joint. And then the rest of them, we'll deselect those two. You have 5 more. So there's one, that one's called the cuboid, lateral cuneiform, medial, intermediate cuneiform, medial cuneiform, and this one is the navicular. So 1, 2, 3, 4, 5. You don't have to know those other 5 names. You just have to know the calcaneus and the talus. So we'll deselect those. All right. So in your hands you have metacarpals. Well, in your feet they're called metatarsals. 1, 2, 3, 4, 5. These are the bones of your feet. Those are not your toe bones. Those are analogous to your palm bones in your hands. And they're also numbered 1 through 5. So the metatarsal that is connected to the big toe is called the first metatarsal. This is your second metatarsal, third, fourth, and fifth over here on the lateral side, because your big toe is medial rather than lateral like the thumb is when you're in anatomical position. Okay, so the fifth metatarsal is going to be connected to your little toe. All right, so that's pretty easy. So if I highlighted that one pointed to that one on a lab test, you would know, okay, this is the left foot. That's going to be the left 1, 2, 3, 4, fourth metatarsal. That's pretty straightforward. Okay, and then you also have phalanges. Your toe bones are called phalanges, just like they are in the fingers. And your big toe, you have a distal and a proximal phalange, or phalanx. I'm sorry, phalanx rather than phalange. Phalanx. We'll deselect those. And then your toes, you have a distal, a middle, and a proximal phalanx, just like you have on your fingers. And then, those individual bones there are wrapped up with some ligaments. Let me hide the ligaments so you can see what the actual bones look like a little bit more clearly. See what they look like when all those tissues have been stripped off. All right, so on the lab test, if we were looking at this and that bone was highlighted, all right, this is your big toe, so that's number 1, 2, 3, and 4. This is a left foot, so this is going to be the left fourth middle phalanx. Over here, this would be the 1, 2, 3, 4, fifth phalanx, or that's the fifth toe. So it's going to be the right fifth distal phalanx. This one would be the right second proximal phalanx. So those are not too hard as long as you keep your left and your right straight. Left and right straight. Just remember that the foot has an arch in it, curves like that. That can help you orient a foot and figure out whether it's a left or a right foot. And speaking of those arches, we've got a couple of features to talk about before we completely wrap up here. The arches of the foot. So if you're looking at the foot from the side like this is what we typically call the arch in our foot. This is the longitudinal arch that runs along the long axis of the foot like that. That's your longitudinal arch. And there's another view. There's the longitudinal arch of the right foot. The transverse arch, all right, so if you're looking down on top of the foot or think about the top of your foot, it curves over the top like that. That's called the transverse arch of the foot. So let me kind of draw that in. That might be the easiest way to visualize that. All right, so the top of your foot curves as well. So going across that way, that arch type shape you have there and over here, that's your transverse arch, okay, as opposed to your longitudinal arch, that's going to be your longitudinal arch over there on the left-hand side. And I think that pretty much covers it. So best thing to do with the skeletal system is practice a lot. Go back and use the video clips. I'm also planning to post video clips from Miss Graham that she made in one of our laboratories here where she's actually working with an actual skeleton. And those are probably going to be a little bit shorter and not quite as detailed. I've probably given a little bit more information and kind of walked you through things here with visible body. So if you need a quicker refresher, you might want to watch her videos using the real skeleton. Plus they're funny, so you'll like them. And best thing is just to use the review activities as much as you can and practice naming, spelling out the names. Practice, practice, practice. I mean, there are hundreds of practice questions for you guys to use before you actually try to take the real lab test on the skeletal system. This is going to be the most extensive anatomy test you will likely have for either Biology 201 or 202. There's more to learn with the skeletal system than for any other body system, at least in our courses here at Calhoun. All right, well, thank you very much, and please do not hesitate to contact me. If you have any questions about the skeletal system or something's unclear, please just let me know so I can clear that up for you. Thanks a lot.